All right. Okay. I don't know if my camera is working or not, but I'm going to talk anyways. This is part four, I think, of cardio, term four cardio. And I'm going to continue be doing the SNL questions. Again, a couple of announcements. First, like this video, subscribe to the channel. Two, go to the playlist section. There you'll find many more videos. I know the camera is glitching. I know I'm getting cut off every 5 seconds. So under playlist, you can find more videos on each exam for each question bank, study strategies, whatever. And number three, I forgot what number three was. Oh, I'm gonna put down in the description a way of communicating with me. If you have any questions, concerns, ideas, uh, contact me there. Okay, let's get started. Where this thing uh, crashes away. All right. So we were at question 43. We were describing how something like a verapamil can slow our heart rate, and we explained the difference between dihydropurine, which is something like verapamil, versus non-dihydropurine versus dihydropurine, uh, calcium channel blockers, right? Okay. So the way amlodipine works is that it blocks the calcium channel on the vasculature, and that I think I know why this is lagging. But so let me just minimize myself and just. I think the battery is too low. Like it goes over 10% and under 10%, and every time it goes over, it start recording. Every time it goes under, it stops recording. So just don't pay attention to me. Pay attention to the voice. Um, so the all the nitrate compounds, the way they work is that they venodilate, right? They venodilate. That's important. When they venodilate, they decrease the preload of the heart. Preload is that's the pressure of the blood that's coming back in the heart. When you decrease the preload, the heart is working way less. The heart's job becomes much easier because the heart isn't stretching as much, so it's not consuming as much oxygen. So nitrates are useful when your heart is ischemic, right? You don't have a lot of oxygen. You want the heart to use less oxygen. You want the heart to do less work, and that does mean the heart is going to become a crappier heart, but it also means it's going to live longer, right? So by decreasing preload, the heart gets filled less. That means the heart isn't going to beat as hard. That means the heart isn't going to feel ischemic, right? That's how nitrate works. And they venodilate. That's important. They don't vasodilate. They venodilate. They dilate all the venous veins, and they cause pulling of the blood in the venous system. Now compare that to something like hydralazine. Hydralazine vasodilates and it decreases afterload. That's also useful, right? Especially if you have a hypertensive crisis, you want to like really fast decrease the pressure of your systemic arteries, right? Nitroglycerin, same story. Prozicin, kind of similar to hydralazine. Okay, it's 44. So the answer to this one is verapamil. Just like I explained here, it can decrease the heart rate. Now, let's just check again. I don't want to. Yes. 44. 66-year-old patient with COPD, stable angina, peripheral vascular disease, and hypertension, right? Okay. I'm just creating a mental model of what that looks like in a patient. His hypertension is persistent. Um, Physical examination decides to add a drug. The physician decides to add a drug to this regimen. That okay. Preferential dilates arterioles. I just talked about this, right? Said hydralazine. Uh, Dilates arterioles. I think the way it does it is that it increases CGMP. In so remember the arterioles is where our pressure drops. The way that works is that you have these bigger vessels like the muscular arteries, and these like arterioles come off it, and there's a lot of these. And right when they come off, there's kind of like these like sphincter looking things. These guys are what controls our blood pressure, because if these guys open up, all the pressure like in this vessel crashes down, and if they close down too much, pressure builds up here crazy, right? So when someone has pheochromocytoma, and these guys are regulated with alpha 1, right? When you have pheochromocytoma, when you're overdosing on cocaine, when you're doing all like something like that, when you have crazy blood pressures, this is where the problem is, right? This is where the problem is. These guys are all closed. And also, when you're tanking your blood pressure, this is like they all are open at the same time. That leads to tanking your blood pressure. Hydralazine works here, so you can tell hydralazine is a good agent in controlling your like arterial uh, blood pressure, right? So you use hydralazine. The mechanism of action is through CGMP, cyclic GMP, but it's not like I haven't seen it come up ever. Let's look. Uh, it also says you can also use something like, oh yeah. So when you have, yeah, you can use stuff like methyl. But this is only pregnant. But the other point is hydralazine is safe in pregnancy. Uh, so is methyl dopa actually, and methyl dopa causes the both actually I think cause lupus. I know methyl dopa does. Probably the hydralazine too. All right. 69-year-old made it to intensive care after bypass, 1 hour of heart failure, pressure is normal, heart rate is a little low, respiration's okay, blood pressure is okay. There is an absence of a P wave. Okay. Uh-oh. Okay. So absence of P wave, what does that mean? That means um answer is spironolactone, I think. And I'll tell you why in a second. So let's think about this. Spironolactone. Let me explain first what spironolactone does. Spironolactone blocks um, mineralocorticoids, right? By blocking that, it increases potassium and um, decreases Na, right? So since Na mostly extracellular, when you decrease Na, you lose the extracellular compartment a little. That helps with blood pressure, right? So uh, when you have absence of P waves, that's indication of you already have high K, high potassium, right? So this guy already has high potassium. If you give him this thing, if you give him spironolactone, it increases potassium even more. That's why spironolactone is known as a K-sparing diuretic. All diuretics make so ABC in the Philippines isn't even diuretic, right? Can't get rid of that. But ABC, they all decrease potassium, and of course they all decrease sodium. That's how mainly diuretics work. Like you gotta get rid of sodium. There's like so B, these guys will also get rid of calcium, but hydrochlorothiazides would retain more calcium. Spironolactones, what's important about them is that they keep more potassium. Let's hope I was right. Yeah. Uh, so no P waves. It meant AFib. I just thought it just means there's no P wave for no reason. But apparently this is AFib, and AFib is exacerbated by hyperkalemia. I hope this is still recording. Let me see. I don't know. I hope it's at least recording my voice. Okay. It's not, I'll record again. Reno, 52. 52-year-old. Oh, question 52 is a 52-year-old guy. Severe pain and like the joint, the finger joint, metatarsopharyngeal, these joints, right? You can't see them, but it's like the knuckle joints. Uh, it wakes him up from sleep. Okay, whatever. Uh, so okay, so this supposedly is trying to say like this is like a lupus thing, right? Or you know what lupus is. So watch out for descriptors of lupus in the context of like drug resistance, or sorry, drug induced lupus, because it can be really tricky. You can easily like be like, what is it talking about? Uh, okay, what is a drug that causes lupus? The thing is, no, I don't know. I think it's phenoldopan. If it's not, so metabolism is a high. Oh wait, it's not lupus. Excuse me, it is not lupus. It is. I think it's pseudo gout. I don't know if you know what pseudo gout is, but pseudo gout can be. It's calcium pyrophosphate. I think pyrophosphate is two phosphates. Phosphate. It's the I stands for inorganic phosphates binding together. And this is a calcium phosphate. So this is like this crystal. And so when you have hypercalcemia, you get this shit. And so what causes hypercalcemia? A thiazide diuretic, and D is a thiazide diuretic. This is a long shot for me, guys, but that's what I think it is. Yes, yes, this is beautiful. Uh, I want to see. Oh, I guess it's not pseudo gout. It's just increases uric acid as well as calcium. So it could also literally be gout that's been described in this patient. There could also be pseudo gout. No one knows. But it's probably gout. So again, 53-year-old, no, 60-year-old, considering treatment for hypertension. His current medication is ineffective. Dilate his blood vessels. So this acts on the calcium channel of the smooth muscles to lower the blood pressures, right? So remember I said like, okay, these are the muscular arteries. Some arterioles come out, right? They have these like sphincters. One of the things that work here is what is our hydralazine, right? And but the other thing that works here is our calcium channel blockers, and these guys they're dihydropurine type blockers, and they end with dopine. So we got amlodipine, whatever also dopine. Uh, contrasts with your diltiazem and verapamil. Sorry, not verapamil. What am I saying? Diltiazem is a type is a non-dihydropurine type. So why am I circling it? So the dihydropurine types, these guys work in the conductive tissue of the heart. Again, lorazepam, we already know what that is. It's a sartan. It's a ARB. This is a NO producing compound. Rapamil uh, is ACE. Diltiazem is, as I said, a non-dihydropurine calcium channel blocker. Yeah. 54. 54-year-old woman, decreased libido, has a history of MIs, is taking lisinopril, and a bunch of other stuff. Okay. So taking an ACE inhibitor, a beta blocker, hydralazine, and a K sparring, specifically spironolactone. Okay, breast mass increase, right? Spironolactone has a lot of high yield points. So I already told you this is what does it block? It's a mineralocorticoid blocker, right? Mineralocorticoid is a cortico like a corticocorticoid, so like a corticocorticoid like type of hormone, right? It's all the ones that are derived from cortisol and from not cortisol, from cholesterol, right? So they're all kind of similar to each other. So are androgens, right? So are androgens. So are your testosterone and stuff like that. So this guy, spironolactone, not only inhibits glucocorticoids, it also inhibits some of the sex hormones. Therefore, this is a drug it's talking about. You can get gynecomastia out of that, right? Remember, a bunch of other drugs that can give you gynecomastia is that D2 blockers you use for what? You use for schizophrenia, like all those antipsychotics. It's kind of a you probably forgotten all about it by now, but uh that was last year, MB3 or MB2 or whatever, right? Those guys can also cause gynecomastia. A bunch of stuff can cause gynecomastia. But through a different mechanism here, these guys will anyways, let's not dive into that. So he's asking for what's the other side effect of these. So again, spironolactone, uh, aldosterone effect goes down, right? Usually, aldosterone has the effect of keeping sodium, right? But when it goes down, you go low on sodium and high on potassium. And this helps with blood pressure, right? But so increasing sodium is wrong, decreasing urine potassium. This is right, right? Urine potassium is right because all the potassium is this is blood, by the way, or like body. So these are answer. Again, a bunch of renal questions. 57. It says a 65-year-old man comes to the ER, acute severe chest pain, uh, has long history of hypertension. The patient soon after arriving becomes unstable and becomes unconscious. There is jugular venous distension. What does jugular venous distension mean? It basically means your jugulars are distended. That means your heart isn't taking blood out of the vena cava fast enough, right? That means you have maybe like a right side heart failure or maybe like a tricuspid problem. This guy got hypotension and muffled heart sound. Or so the other thing you could have is that blood, for whatever reason, isn't able to enter the right ventricle or right atrium. One of the things that could cause that is that if the pericardium is already uh, pericardium, so this is, let's say if this is the heart, sits in the pericardium. If the pericardium is like tight and can't expand, then blood can't get into the right ventricle, right? And that's exactly what's happening here. And the thing that gives it away is muffled heart sound. Why would your heart sound be muffled? Well, the answer in this case is that you're bleeding for whatever reason into the pericardium, right? So this is called cardiac tamponade. Tamponade, right? Three things. One of them is muffled heart sound, hypotension. I don't know if the third one is jugular vein distension, but it will show jugular vein distension as well. So the question asks, oh, what is it suffering from? Cardiac tamponade. So muffled heart sound immediately makes me think of tamponade. Uh, Hypotension, same story. Because listen, this is your heart. Your heart needs to get filled up with blood to pump it out, right? But then you got your pericardium. It's got so much blood in it, so your heart is like basically like not even able to expand to this level. So there's no blood entering here. There's no blood entering here. That's why there's blood built up here that you can see it in your neck, right? This is your neck. That's why the reason it's muffled is because the noise can't travel well through all these blood basically. What do? You stick a needle in here, empty it out. But if you're actively bleeding into that, I don't know how you deal with that. I don't know. It becomes tricky, super tricky. All right, 58. 44-year-old, chronic cough, extreme dyspnea. Okay. So this person, this guy, his dyspnea, cough, went over, had crazy chemotherapy years ago. Oh, the okay. You know, one thing about medicine is that you keep forgetting stuff. Like this drug, Busulfan, I used to know a lot about it. Right now, I just recognize the name. What a couple of things I do remember about it is that I remember. Well, and the good thing on the other hand is you don't need to know exactly what it does. So all I remember about it is that it causes pulmonary fibrosis. That's all I remember about it now. I used to know a lot about it. But how can I solve this question easily and with confidence, even though I don't remember anything about this drug, right? So, um, oh wait, no, you kind of gotta remember the pulmonary fibrosis thing. I thought the question is going to ask what are you going to give this patient. I would give him digoxin because for whatever reason the heart isn't pumping enough because of the chemotherapy. You want it to get pumped better. I would give him digoxin, right? But it's saying what is it similar to? What you got to remember is that the drug amlodipine, which is a great drug in many aspects, for and it's a type 3 drug. That drug has also pulmonary fibrosis, right? You just gotta remember that it's a tough world medicine when you start forgetting stuff. That's why you gotta use Anki. Um, watch my Anki video if you want to learn about Anki. It's in go to the playlists. You can find it there. So cardiac. What am I looking at? 56. Okay. 57. First of all, cardiac tamponade, and yes, amlodipine, type 3. Okay, 59. 56-year-old guy has headache, trouble eating, visual symptoms, jaw pain. It's jaw pain. Wow. A 50-year-old woman has all these. It's just yelling giant cell arthritis to me at this point. And left temporal artery is also occluded. The ESR is slightly elevated. So, I mean, this is important. ESR is important. This is really the only two important things. ESR is usually elevated. The other important thing is in this disease is that you don't wait for the biopsy to come back. You start them on glucocorticoids. Uh, the other important thing is that the answer to this question, which is basically what you see on the pathology, fragmentation of, which is A actually. So in this one, I just remember the internal elastic lamina gets fragmented in this one, and you get a lot of fibrosis within the intima, and it decreases the lumen a lot. Uh, it is you will have granulomas, and that's why the name is giant cell arthritis. But B that says patchy necrosis of media. This is pan. B is pan. Temporal heterogeneity. Oh, displaced temporal. I think this is pan again, right? Different places at different times. Uh, Blood dissection in the media layer. That makes me think of Takayasu's arthritis, very similar to this disease, but it happens in the where aorta is, and it can lead to dissections. In fact, this disease also can lead into dissections. That's an important point. This disease can also uh, lead to like joint pain. I don't think it's mentioned in this question, but yeah, let's go. Uh, E is thrombus in artery containing is talking about Berger's disease as thromboobliterans, something like that. That's the one that's associated with smoking, and like it happens in the digits. Question 60 is a 57-year-old man, sudden shortness of breath, tachycardia. A CT scan of the chest shows a pulmonary embolism. Treatment is immediately begun uh, with treatment that inhibits factor 2A. Factor 2 is thromboplasmin, and 2A is thrombin, right? So 2A is activated, 2 is just thrombin. It's just is it thrombin or is it fibrin? I don't know, one of those two. Uh, let's see what the question asks. Most likely used to monitor the effects of the drug administered in this patient. Uh, okay, what do we use? I told you guys I'm really, really bad at these, but uh, I'm gonna at least show you how to answer a question when you're really bad at something, because stuff like this happens, and it's good to have at least like choose a sensible answer when you don't know what's going on. Immediate inactivation of factor 2A, right? That makes me think of. Actually, I got nothing. I'm just gonna skip this question. You do the thrombolytics on your own. I don't like the thrombolytics. It pains me. It pains me to see a thrombolytic question. On my exam, let's say I got like X questions wrong, and half of those, like X over 2, were only from that one lecture on thrombolytics. I felt so bad after that. I didn't think anything was unimportant. Anyways, story time is over. Certain drug can cause severe hypotension when combined with nitrates. What can cause? So, sildenafil, all the phosphodiesterase inhibitors combined with, they're actually counterindicated with nitrates. Uh, and phosphodiesterases, what they do is that we have GTP and ATP just like hanging out in a cell, and there are these signaling molecules that turn these really fast into CGMP and CAMP. So these are signaling. These are like cyclo adenylate cyclase. These are your like GS is here. Something similar is here.